Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here working with employers, payers, and others on their population health improvement programs. So, Nick, it's been Omicron, Omicron all the time. It's pretty much nonstop. But I understand we're beginning to get some data about that specific variant of the virus. What are we seeing?
Yeah, so we've definitely talked about this, and I think I've certainly been one of the folks that has said, "Hold on, let's see the data." We had data emerge from South Africa. Obviously, there were some confounding factors there that you go, well, you can't just lift up the data and say, well, that's what would happen in the United States. Although everything continues to progress in the same way in the South African data collections that suggest that Omicron is less virulent, causes less symptoms, seems to be milder, let's say. But here's what's interesting. I think we're now several weeks in. So if we were going to see data, we would have seen it now. And there's still people saying, well, let's wait for the data. And I like to wait for the data, but at this point, I feel like I want to call for the same experience in the United States as we've seen in South Africa. And it was specifically Bob Wachter out of California that looked at the San Francisco data. And he did something very elegant that I think is worth exploring a little bit. So he's been looking at a specific number that was the measure of COVID positivity in patients that came into hospitals, because every patient that was coming in for anything had to be tested, because then you needed to know to be able to treat them, isolate them, all of those things. And that rate pre-Delta was about 0.2%. Around December of this year at the beginning, so post-Delta but pre this Omicron surge, was about 0.9 and then went to 4.6 or something. And that tells us that there is a much higher instance because we're positively testing that group. So it's not just people presenting to be tested, they're coming in for other reasons. It's as random as you can get. You can't get to perfect randomness. There's probably some confounding selection criteria and all of those things. So it's imperfect in all sorts of ways, but it's still pretty good. And yet we see flat hospitalizations. So we're not seeing the surge that we would have seen based on that increased rate. So that suggests that we are seeing lower impact of this disease in people, which is good news. That means that we're having less of a clinical impact.
And it appears, Nick, I guess a couple of points. One, that's due to the vaccines, apparently. So these are people who are showing up who are asymptomatic and getting hospitalized, which also raises an interesting point if you think about that population. And you mentioned the idea that it may not be random. Probably not. But those are individuals who actually have comorbidities or other symptoms that are getting hospitalized. So perhaps they would have actually been a higher risk population than the not risk. And obviously that's a early conjecture, but clearly something to think about. It might not be a lower risk population in a sense, so it may even be slightly better than you would think.
That's what I love about statistics. It's very hard to see all of those potential confounding factors, causality versus correlation. And there you are coming up with another point that, just hadn't occurred to me. You're right. Higher potential comorbid conditions because they're coming in for treatment and yet still not seeing that increased death rate. So that's another positive. But I'm sure there are reasons to sort of suspect the data at least a little bit. But at this point, I'm feeling like it's less virulent, it's causing less disease, as you say, in the vaccinated, the unvaccinated, and specifically children in this case, who have a specific problem in that they were late to the party of vaccination, or at least available. I'm sure there's still some that are unvaccinated. And also that means they're delayed in boosting because we want to spread out the boosters accordingly per the schedule. So they're suffering increased rates because they don't have the same level of protection from the vaccination.
So obviously, as you look at this, some people could look at this and say to themselves, well, Omicron is less virulent, so let her rip. But the improvement is really potentially, one, it's less virulent, but two, because the vaccines are effective, particularly when you add that booster. So this isn't something to just say, we don't need to worry anymore, but obviously continue to push vaccinations and boosters for people, right?
Yeah, let's be clear. This is not, oh, okay, woohoo. Not at all. And, what's important here is that it's the holistic approach. It's all the things that contribute to this and everything that we've learned. We're still messing some things up. I think, if you follow me and you see what I post about, I think we're still making some mistakes in this process. Testing is one of them, the availability of testing, free testing, importantly, and for me, downstream negative consequences for testing and then saying I have to take sick time and, the whole issue that predates COVID. But all of the things that contribute to give us this overall protection and better outcome. But the underlying point here that's important to make is a small percent of a very large number is still a very large number that can overwhelm our healthcare system. So if you have lots of people that are potentially more likely to be exposed and aren't vaccinated, which, rates vary, then you've got a problem that's going to present itself to our healthcare system and create some significant challenges for our healthcare workers who've been working their butts off for the last 2+ years, and they can't keep going like this.
Absolutely. And one of the other things I think is important to make, we talked about the importance of vaccines and obviously critical in this data as we're seeing it, but also this concept of wearing a very good mask in indoor settings or others. I mean, there have been some pretty substantial outbreaks. I mean, for the first time in my group of people that I know, I'm beginning to see individuals show up that get infected. And so obviously Omicron is much more contagious in terms of its ability to spread around and get to people. And so this idea of wearing a higher quality mask indoors, I think is critical.
Yeah, I'll just say the counterpoint to that, one that I've certainly positioned behind, any mask is better than no mask, is my key point here. You're right, but wearing an N95 is a whole thing, and people putting them on and just having them, like chin straps, still not effective.
Right.
And they're harder to wear. So if you've got a choice between wearing a cloth mask or wearing an N95 as a chin strap, I would say still wear the cloth mask because it's giving you better results than not wearing anything, essentially.
Yeah, I will say, interesting enough, I was wearing a KN95 last night getting my hair cut. And when I went into the place, it was great. And I took it off for a second, and suddenly I could smell the hairspray, which I couldn't smell with the mask on, which was fascinating. Showed me the fit was pretty good there, so I felt a whole lot better. So once again, Nick, another
before you finish that, Fred, we've just got to point out, I did not know you used hairspray. This is interesting.
Oh, that wasn't for me, but thank you very much. Actually, he did put something in my hair, I believe. Yeah. Another great week. Next week, we're going to discuss hairspray and masks. So please join us. This is Fred Goldstein with Accountable Health. Thanks again, Nick. If you'd like more information, please go to accountablehealthllc.com.
I'm wishing everybody a happy new year. This is Dr. Nick. I'm the incrementalist. Wishing you happy new year, better business, better health.